Good afternoon and welcome to Facebook Live. This is Dr. Bill Bird. I'm the Chief Medical Officer at CGH Medical Center, and thanks so much for joining me today. So today, two things are going to happen. The first thing, as usual, I'm going to give a brief COVID update, and then after that, I'm going to bring on Ozzie, one of our nurse practitioners in our GI department, and Ozzie is going to and Jaziel Chavira. And Ozzie's going to talk a little bit about liver disease with me. We're going to do some Q&A on that, and I think you're going to find out some good information about liver disease today too. So let's start with our COVID update as usual. I'm going to have Matt put up our graphs for the week. So top left graph, the red bar are the number of cases in Whiteside County this past week. The red bars this week, the blue bars the previous week. The bottom left, same idea, but 2 week increments. So the left, the red is the last 2 weeks, and the blue is the 2 weeks prior to that. So obviously you can see that there's continuing to be, we have not peaked yet in terms of this Delta surge in our area. And if you look over to the right there, you'll see August 9th's numbers in terms of the number of cases and the positivity rate. And I believe Matt has another one of those. Okay, so that's 11th was yesterday. And you can see the number of cases, the positivity rate. And you can kind of see the bar on the bottom there. We're starting to see a blip up there. And that, once again, is this surge that the country is experiencing, some to more extent than others. And then I think the final graph we have today is the one that we show pretty often. And all this is trying to say is that there's a tug of war between natural immunity, which is basically folks who have been infected, and people who are immune because of their vaccination status, versus the different variants, Delta being 93% of the infections in our country right now, and then how we behave, how we go about living our lives, that being all that, including whether or not we're willing to get vaccinated, wear masks, all those type of things. So I thought about it, and I think today I would still say the bar, the arrow points towards natural immunity and vaccination. But boy, it's pretty close to flipping in the other direction. And because our numbers have, as I said, they are not going down yet. So those are some graphs I wanted to show you. I wanted to just some recent facts to share with you. So many of you may have seen this. What is our percentage of people been vaccinated? Marianne's asking that. I think countywide, I'm going to about 43, 44%, Marianne. I don't know the exact number, but that's last I saw on that. And Pat was wanting to know, okay, so yeah, good question, Pat. So I was, one of the things I was going to share in terms of facts is I saw this week that the CDC recommended for boosters for folks who are immunocompromised. So I don't know if you also, I think, Pat, threw in a question about the elderly. I don't know that what I read included the elderly. Wouldn't be surprised if at some point in time they get put into that camp. But I know for what I'm pretty sure I remember reading that the CDC did recommend this week for people who have immunocompromised situations that they should be getting a third vaccine. So good question. Heather, increase in COVID patients. Okay, so since the surge began, I don't know, 6 weeks ago, we've always had someone who's in the hospital with COVID. So sometimes more, sometimes less. It's definitely not at the level of hospitalizations that we had in November and December so far, thankfully, and that's encouraging. But yeah, we continue to have COVID patients, and we didn't have COVID patients in the hospital for close to 2 months. So yeah, it's definitely have a bit of an uptick. And in terms of kids, yeah, and I think the numbers that Matt showed us just previously, Heather, on those red bars, Matt, could you pull that up again just so we could show that? There we go. So those red bars after the left side where it shows the overall numbers for the population, then you start seeing for different age groups, And you can see for under 20. So I would say, yeah, that tends to be right now probably the biggest group of folks who are getting COVID are people under the age of 20. So good question. Yeah, I can appreciate all those questions. A few more facts. So just saw this week that CDC is recommending for pregnant women to get vaccinated. That's based upon doing a study of 2,500 pregnant women, and the miscarriage rate for across the country, the miscarriage rate is between 11 and 16% for just general population of pregnant women. And for people who have been vaccinated, that rate was 13%. So same. And based upon that, the CDC is recommending that. And so that's another recommendation. The CDC I was looking at this on July 16th, talking about kids and vaccinations. As of July 16th, 8.9 million kids had been vaccinated. That's 12 to 17-year-olds had been vaccinated in the country. And of those, 859 had a serious adverse event. That is 1 in 10,360. So, we've talked about this. Vaccines do have side effects, and people do have side effects from vaccines. If you look, though, if you compare that to the kiddos who in that age group who test positive for COVID, who end up being hospitalized, and even some that die as a result of that, the arrow goes way towards getting vaccinated in terms of the risk there versus the risk of people who get sick and then have complications from COVID. So I mentioned Delta's 93% of cases in the country right now. It's obviously easier to get. It's the vaccines, particularly Moderna and Pfizer, are continue to be highly effective in terms of preventing severe disease. Just before I went on today, I saw something that it's just a study done at the Mayo Clinic, and it looks like right now, and this will kind of get played out here in the next week or two, I'm guessing, but that the Moderna is doing a better job in terms of just preventing infection in the first place. I think I saw 88%, and I saw 46% for Pfizer in terms of just preventing infection in the first place, but both are still highly effective in preventing the main thing we don't want to have happen to folks, and that's so they get so sick that they have to be hospitalized or worse yet, that they pass away from this virus. So yeah, cases are still on the rise in our area. And another fact we know is the more cases we have, the percentages say a certain percentage of those people will get really sick. So you want fewer cases so you have a lower percentage of really sick people. And that's what we're going with. And I mentioned this last week, and I'll continue to kind of mention this, but just keep in mind that whether it's the CDC or the Illinois Department of Public Health, Whiteside County Health Department, even your own personal physician, they are making recommendations with the best information and evidence they have at this particular moment in time. That's how science works. You make a recommendation based upon the best information you have at that moment in time. And you also know that you're going to change that. I mean, that's just how science works. So there'll be adjustments to the recommendations. We expect that. An example I would give you is blood pressure control. So, in practice, there was something called the Joint National Commission on Blood Pressure Control. And, they update that here and there. And we're actually, so in terms of blood pressure control recommendations, we're on JNC number 8. So it's been amended 8 times, and I was just reading through that before we went on, and I suspect we have sometime in the near future we might have JNC 9 because JNC 8 was 2014. So that's how medicine works. That's how science works. Is you act on the best information you have, and then you go from there when you find new information out. So, just some other numbers, and then we'll get Ozzie on here. Right now we have in Illinois 1,158 people that are hospitalized. Contrast that to June 22nd, there were 460 people hospitalized. And there are 145 people in Illinois on ventilators at this moment, as of yesterday. And on June 22nd, there were 57. So obviously that just speaks to more cases, more people that are getting sick. Yes, Gary, absolutely. And it's not that our hospital is running the analysis, but the overall Illinois numbers that the state lab is doing is, last I saw, was like 93% or more. So yes, it is we definitely have the Delta variant as what's causing vast majority of infections right now. And in terms of vaccination, where we're at in the state, we're averaging 23,631 vaccines a day for the last 7 days, which is better than we were doing. I looked at July 7th, and we were at 17,771 vaccinations per day for a rolling 7-day average. So I think this Delta variant, people are understanding that they're at higher risk of getting sick and also getting very sick, particularly if they haven't had the vaccine. So anyhow, I'm encouraged that our numbers are ticking up of people vaccinated, but I'd sure like to see it go up quicker. So what are my recommendations? For all of you? Follow the science. Don't get too swayed by pundits, politicians, and posters. And yeah, get vaccinated. The CGH still has a vaccine clinic, 8:30 to 2:30 here at the main clinic, and we're giving Moderna and J&J. And I know the health department continues to do vaccine clinics as well. Oh, thanks, Matt. I appreciate it. So yeah, there you have it. And yeah, and I think it makes sense to continue to wear a mask too. Particularly when you're indoors, wear a mask. It doesn't hurt anything. And particularly this, like I said, just what I read today about the Pfizer vaccine, that you could still get it's really unlikely you're going to get so sick you have to be in the hospital. But why get sick at all? We can just throw a mask on, and that way you're not nearly as exposed as you would be if you weren't wearing one. So I recommend to do that as well. Okay, so that's my COVID update today. A little more lengthy than usual, just because there's a little more going on right now. We're going to keep telling you the way that we understand it and information that we have, and we'll keep you up to date and be transparent about what's going on from our perspective. Oh, April. Yeah, I don't know, April. A certain percentage of specimens that I think go to the state lab get tested, and that's how they run it off of that. I'm assuming that they can't do every test, so they're going to have to do a sampling of tests, and whether that's done at the state or at the CDC level, I've got to think that's how they go about running those. Jamie, positive COVID count. Yeah, I'm with you, Jamie, on that. Get vaccinated or wear a mask. So yeah, if you went back to July, we were in June, we were running positivity rate at I remember at least one day that we were below 1%. And most of the time we were, yeah, that's now. But if you go back, and Matt, we don't have that information to show today, but if you go back and look in July, and particularly I think late June, we were in that 0.8%, 1.4% range. So yeah, it's definitely gone up compared to that period in time. Okay. I like to bring Ozzie on. I like Ozzie. Hi, Ozzie.
Hey guys, how's it going?
Good. Good to have you. Good to have you, Ozzie.
Thank you.
And for the folks who are watching us live, thank you so much. And if you have questions for Ozzie, if you have any follow-up questions on COVID, just keep sending them our way. We'll do our best to answer them. I was teasing Ozzie. Ozzie's, you've been with us as a nurse practitioner you've been an employee at CGH for years, I know, Oz, but first practitioner, a year?
Yeah, just over a year. I think I came over here in June, started seeing patients in August, I believe.
Yeah. And I was joking with Ozzie. He keeps a very Spartan office.
Right. We're all business. We're minimalist.
Yeah. I'm like, people are going to think that you just cleared out your office. This is your last moment here at CGH and you're on your way out. And I can assure folks that Ozzie's here to stay as long as he wants to be here. But he's very tidy, I can tell.
Keep it simple.
All right. So we're going to talk a little bit about liver disease today. Ozzie obviously deals with a lot of that in his office. So Ozzie, here's my first question for you. I got to flip my page over. Yeah. So what kind of symptoms would someone have if they have either like acute or long-term liver disease?
Well, a patient could present with like nausea, vomiting. You can have abdominal pain, sometimes fever. You might be having dark urine or like clay-colored stool. As things progress, if it's more like advanced liver disease, like for example, a cirrhotic, you could have like ascites, which is accumulation of fluid, particularly in your abdomen. You could have something called hepatic encephalopathy, where you're acutely confused, and then like esophageal, like a varices in your esophagus or your stomach as well. So those are all kind of examples of how you might present to an office with liver issues.
Yeah. So in a nutshell, it's a lot of different stuff.
Kind of all over the place. Jaundice as well, like yellowing of your eyes and skin. I don't know if I mentioned that, but
yellow or orange, that's not a good sign in terms of livers.
Correct.
Yeah. Okay, I just want folks to get a sense of, like, first of all, what you'd be looking for if you might have liver disease, and then I wanted to start talking. We're gonna do the ABCs to start with, Oz. We're gonna do hepatitis A, B, and C.
All right, let's do it.
Those are pretty common things that cause some liver issues. So first of all, how do you get hepatitis A, and what is it?
So hepatitis A, it's a virus that you can get. It's spread through contact with blood or fecal oral transmission. So I think of like food and water. So if you're eating from the wrong plate, if an infected person doesn't practice proper hygiene, prepares a meal, or you take a drink from the wrong drink, it can be spread through having unprotected sex with an infected person. You're going to see in all of these some commonalities in transmission modes, like risky behaviors such as unprotected sex, IV drug use, things like that. Can get you into trouble. So,
I think the one I tend to hear in terms of hepatitis A is you'll hear about an outbreak with hepatitis A connected to like a restaurant where someone who has Hep A and they're preparing food, and then sure enough, you have a little outbreak because they handled the food and then people ate it. And
it's unfortunate, but it does happen. That's why a lot of restaurants you go in, you'll see signs, mandating employees to be certain to wash their hands and do so appropriately with soap and water for a given amount of time. So, yeah, it's very important.
Let me ask you this. Is there anything that, short of not going to a restaurant, is there anything that you can do to try to prevent Hep A?
So, well, again, touching on hygiene is a big thing. So ensuring that you're washing your hands appropriately will help. Other vaccines as well, good prevention strategy. Limiting your risky behaviors. So, unprotected sex, IV drug use, things like that. Immune globulin. And again, I think the big one, though, is hygiene, vaccines. And you'll see that again across all of these that will help. So
Sure. So what's the treatment for hepatitis A, Ozzie?
Usually it's actually just supportive care. It tends to be self-limiting. So proper hydration, rest, nutrition, things like that. So like I said, it's a self-limiting, in most cases, condition.
Yeah. Like if I had to pick one, I think I'd like A.
Yeah, right? Go with the best one.
You get to pick and choose the viral hepatitis that you get. I'd go with A.
For sure.
Yeah, let's talk B though. So tell me a little bit about Hep B. What's the deal with that?
So B is a little bit different in the sense that it's spread via contact with an infected person's blood or semen, or bodily fluids containing those things. So again, high-risk behaviors like unprotected sex, IV drug use, all those will, can get you into trouble, and they can be transmitted that way.
Yeah. So Hep B has a way to prevent it though too, doesn't it?
So vaccine is the main prevention for Hep B. And by the way, there's combination vaccines where you can get vaccinated for hepatitis A and B, for example, like Twinrex, where it's a series of 3 shots over 6 months. And it's proven to be quite effective. So yeah, get your vaccines.
Yeah, another vaccine opportunity, right?
Right.
All right. So with Hep B, what do you do if you get let's say you have an acute infection? What do you do? What's the treatment for that, Oz?
So again, for Hep B, it is a supportive care for acute, short term. Chronic is a little bit different. Like a long-term chronic, there's various antiviral medications that can be implemented for that. A lot of the treatment is based on your viral load, other medical conditions, specifically other liver conditions. So yeah, but there are various antiviral drugs out there for the treatment of Hep B.
Right. So does Hep B, if you have it and it doesn't get treated, or you have chronic that doesn't seem to respond to treatment, can it lead to liver failure?
So it can progress. Same with Hep A. It's pretty rare with Hep A, but Hep B can progress to advanced liver disease, cirrhosis, and you'll see this with Hep C as well. As if it progresses and becomes serious, you're at a higher risk for like hepatocellular carcinoma, which is like liver cancer, and of course that can result in death. So it could potentially be a serious, pretty serious condition. Yeah,
I can. Okay, so Hep C. Tell me about that. Tell me about Hep C.
So out of the 3, I've probably seen Hep C probably the most common. It's spread through contact with an infected person's blood. We see this a lot, primarily with people with a history of IV drug use. I forgot to mention too with Hep B, you think with childbirth, mother to child. So that's an issue. But with Hep C, we get, it's quite common, and it's spread through contact with infected blood. Yeah.
Okay. So Hep C, there's good news about. Tell me, you want to talk about the good news with Hep C?
You're referring to the treatment?
Yeah.
So treatment has come a long way. If you kind of do research at the way it was treated before, right now it's usually 8 to 12 weeks of oral antiviral therapy. Examples of that would be like Mavorite, Harvoni, Eclusa, things like that will help. But yeah, it's usually 8 to 12 weeks. Patients do very, very well with it and seem to respond very well. So.
Yeah, I mean, and which is really encouraging, because it can be pretty devastating. And once again, if that continues and you have it and you don't treat it. Correct.
So like some of the other ones, it can progress into advanced liver disease. You can become cirrhotic. Your liver starts to scar, all the damage and inflammation.
Yep.
If you get enough scarring, then you become cirrhotic, which places you at a higher risk for liver cancer. And of course, that can be fatal.
Yeah.
So, it's important to get it identified and treated if you do have it.
Right. If I remember right, it used to be that Hep C, was like probably I think it was like the #1 reason that you'd have a liver transplant. And since we have this treatment for it, I think it's really gone down on the list some because people are able to get treated and they don't progress to complete liver failure.
Correct. Another thing too is the screening guidelines have changed, and so now basically all adults, pregnant, females, people with high risk behaviors like IV drug users and things like that. So screening along with improvement in the treatments have really helped. So we've come a long way with Hep C. Still got a ways to go, but so far we're doing better.
Yeah. Okay, I'm going to go off. I'm going to get away from the ABCs now.
Okay.
We're going to talk a little bit about Nash.
Okay.
All right. So I'm going to let you explain to our audience what Nash is.
Okay. Nash, quite common. We see that a lot. Unfortunately.
What does that stand for, so folks understand that?
Sure. Nash stands for non-alcoholic steatohepatitis. So it's non-alcoholic, so not having to do with alcohol use. Steato meaning fat, hepatitis meaning inflammation or injury to your liver. So it's liver damage as a result of things to do with other than alcohol. So unfortunately, Americans, we don't eat the best. Sometimes myself included. But we eat a lot of fatty foods, high processed foods. Poor control of blood sugars can affect that as well. But what happens is we start to accumulate fat on our liver, and over time that produces inflammation. Over time, that inflammation can lead to scarring of the liver, and in severe cases, that scarring, if you have enough of it, you can become cirrhotic, like these other conditions, and you end up with advanced liver disease. So it's very common. A lot of times it's picked up just by chance. You can come in for your routine labs, maybe a yearly visit with your doc, and maybe one or two of your liver enzymes are elevated. Then you'll do an ultrasound, and they'll say, "Hey, this guy's got some fat on your liver," and then you usually end up in our office, and you might end up having Nash. But that's kind of in a nutshell what that is.
Yeah, and so treatment-wise?
So treatment-wise, a lot of it is straightforward. It's reversing the lifestyle and dietary things that got us there. So low-fat diet, weight loss, exercise, good control of your blood sugars is key, and avoiding further injuries to your liver. So you want to minimize your alcohol use. We try to eliminate potential medications that could be impacting the liver. But the big part of it to me is just really focusing on that diet and changing your lifestyle around.
Yeah. Yeah, very good. And then you mentioned avoiding medicines that could hurt your liver. That's kind of the final thing I wanted to touch on today. So can you kind of talk a little bit about some common medicines that people may or may not think of that they have to be kind of aware of in terms of how it affects their liver?
Sure. So a common one that we hear a lot is Tylenol. Tylenol, you should keep it under 4 grams per day. But some other lesser known ones, some certain cholesterol lowering medications. You got to think a lot of our medicines we take are going to pass through our liver. So certain antibiotics like erythromycin, I believe augmentin, azathioprine, methotrexate, things like that. They can all impact your liver. If you have any kind of liver condition or suspect one, when you talk to your physician or your primary, your provider, be sure they're going through your med list and looking for any kind of potential culprits in your medications.
I want to go back to the Tylenol.
Mm-hmm.
So what would you say the maximum amount in a day that a person should take?
4 grams. So 4,000 milligrams or 4 grams.
Okay. All right. Mm-hmm. That's a little more than even I remember. I for some reason I was thinking it was 3. But yeah.
Yeah, I don't know if that changed over the years, but 4 grams would be the maximum.
Okay. Yeah, I know for my patients, I tended to be I probably erred on the side of saying more 3, even though you probably could go up to 4. But something to remember about Tylenol is just that some people will find themselves, there's Tylenol in some things that they don't realize. And they'll take, like, for instance, Norco.
Right.
has Tylenol and then hydrocodone in it. And
Right.
so some people will get in trouble because they'll take Norco and then they'll take Tylenol in addition. You can take Tylenol in addition to Norco. You just have to add the 2 dosages up to make sure you're not hitting above that 3,000 to 4,000 range in terms of Tylenol. So just,
yeah. Pay careful attention to your meds. Sometimes, you think it's just a single medication and it's a combination drug.
yeah.
But just like you said, you want to make sure you're tallying all, everything is a total, and you're not going over that daily maximum dosage.
Yeah, for sure. Yeah. Oh, yeah. Yeah. I'll take that one on. Yes, there's definitely safe statins you can be taken for cholesterol, Kathy. And matter of fact, the incidence of liver like true liver damage from statins is really rare. But that's why your doctor, on occasion, when you're on a statin, will run liver enzyme tests just to make sure that your liver's happy. We want happy livers.
That's right.
Yes. So good question. All right. Well, hey, Oz, appreciate your time.
No problems. My pleasure. Thanks for having me.
Yeah, been good having you today. Feel free to throw a few pictures up on the wall sometime. Okay.
I don't know. I might get distracted.
All right. So, and I just wanted to tell our viewers also that just a heads up for next week. So next week, Dr. Coons is going to take the baton from me for a week, and he'll be giving the usual COVID update that we do, and then he'll have from our birthing department have some folks on to talk about breastfeeding. So I think that'll be a good episode. Dr. Coons always does a really good job. He's always informed and interesting to hear what he has to say and the questions he's going to be asking them. So I encourage you to check that out next week. Until next week, thank you for watching. Thanks again to Oz for being on with me. And I hope you all have a great week and a safe week. Thank you.